My name is Bree. I'm a registered nurse and a student at Worcester State University in the Master's of Science in Nursing program on their nurse educator track. And today I'm going to be talking to you guys about integration of artificial intelligence in nursing education. So we're going to cover quite a few topics today, and I encourage you to ask questions throughout as necessary to help you. Oh my fucking God. Nope. Hi, everybody. My name is Brianne. I'm a registered nurse and I'm a student in the Worcester State's Master's of Science in Nursing and on the education. Hey, everybody. My name is Bree. I'm a registered nurse and I'm a student at Worcester State University in their MSN program on their nurse educator track. And today I'm going to be talking to you about integrating artificial intelligence in nursing education. So we're going to cover quite a few things today. So please feel free to ask questions to help with your learning. So first, we're going to cover AI and what it is and give a little background to it. Then we're going to apply it to nursing education and see how it has been historically used in the classroom. I'll touch on the teaching method revolution and how we've integrated AI slowly into that. I'll talk about virtual reality simulation. I'm going to discuss the alternative uses of AI in nursing ed. I'll explain why it's important for us to discuss this. I'm going to briefly touch on NCLEX and the use of AI in NCLEX. After that, I'm going to talk about the drawbacks to using AI in nursing ed, the future direction of AI, and then I'm going to end with some conclusion and questions. So first off, what is AI? So AI stands for artificial intelligence, and artificial intelligence is a computer system that can basically perform any task that we would complete as humans. This can include making decisions such as clinical decisions in regards to healthcare. It can also perform problem-solving tasks like medication math problems. AI first was developed in 1950s when a gentleman named Alan Turing brought up the idea that machines could think. Basically, he created what's called the Turing test, which tests the ability of machines to exhibit intelligent behavior that's equivalent to human intelligence. As time progressed, more research and development occurred to help refine AI's ability to mimic human reasoning. And by the end of the 1990s and the 2000s, the increase in data storage and computing power in computers allowed AI to be used more widespread for practical purposes like voice recognition, electronic health records, and even decision support tools. So there's a couple types of AI. The first one is narrow AI, which performs specific tasks that we ask it to do. So this can be ChatGPT, it can be Google Translate, it could be your Alexa in your home. Next is general AI, and that's also called strong AI. And this version thinks and reasons like a human would. Basically, it allows for hypothetical reasoning, as humans do. And then finally, we have super intelligent AI, which is actually not something that's a thing quite yet, but it's a future concept where AI is actually able to surpass the human intelligence system. Currently in healthcare, we use a lot of narrow AI in many forms. Like I said, AI originally started to become part of healthcare back in the 1970s when Stanford introduced what's called MySIN. So MySIN was a computer program that used AI to backwards identify strains of bacteria. And at the time, MySIN was a really big thing in its situation. It has a significant positive effect on the healthcare industry, and it really showed the true power and potential of AI's decision making and its potential for healthcare. In the 2000s, we started seeing more electronic health record use. We moved away from paper charts. We also saw AI being integrated into medical imaging, like cancer detection. And then in current day practice, AI's use is really widespread across many professional organizations. Even the FDA has endorsed and approved the use of AI-based tools to mainstream tasks, which increases productivity in the workplace. So the adoption of AI into nursing education was actually a bit slower and more gradual than its incorporation into healthcare in general. However, in the 1990s, nursing programs started using simulation-based nursing that used computerized-based programs and assisted in simulation for nursing. It was also around that time that programs started using AI to help students practice their care planning, and it helps provide effective feedback on specific sets of outcomes. The incorporation of these things was not, like I said, not widespread originally. It was primarily limited to like special simulations, such as like hospital teaching campuses or specific research settings where they had needs for it. As we hit the 2010s, though, we saw an uptick in something called adaptive learning platforms. So these are educational systems that use AI to track how students perform and answer questions, and it modifies that material that they're learning in real time in response to the trends that are tracked. Some of these platforms you might recognize as like Kaplan Nursing or Elsevier Adaptive Learning. A lot of programs use them nowadays. In the 2010s, we also saw an increase in virtual patient simulation, which is something I'm going to cover soon. And then finally, chatbots were something that gained a lot more usage, helping students answer questions regarding course content, homework, or even like reflective journaling. If you look on the right of the slide, you'll see a graphic presented by the Pew Research Center, which basically shows the uptick of individuals who have stated that they've used ChatGPT. So it starts in July of 2023 and ends in February/March of 2025. And you can see that there was a really large uptick in the age group of 18 to 29-year-olds, which happens to coincide with the majority of college students. So, as time has gone on, nursing education has adapted to a lot of changes in technology. We've undoubtedly seen an increasing technology inclusion in nursing education, and we began seeing that once our healthcare field started incorporating it more. We've transitioned from a lot of lecture based classrooms to simulation, and most recently, we started using AI and online platforms. AI has helped us really make strides in our nursing education because it's helped us move away from unimodal, simplistic ways of learning to a more comprehensive and complex model that really mimics the true condition of the healthcare field that we're sending our students to. But you can see that we start with simple mannequins, and that allows students to work with their hands on low fidelity simulations. This means that simulations are not allowed to talk, and you're not allowed to take blood pressures and stuff. It's very simplistic. As time progressed, we started using higher fidelity sims. You could talk with them and they'll talk back. You could assess their heart and lung sound. You can put a catheter in them. And these higher fidelity sims allowed you to practice an increased variety of skills. However, the downside is they're extremely, extremely expensive. But it was a better thing than the original mannequins. So during the COVID-19 pandemic, many nursing programs had to move to an online format, but their students still needed to complete their clinicals. To accommodate that, we saw a boom in online nursing platforms, so like vSim for nursing. The benefit of these online platforms was that there was a wide variety of skills available for practice in one centralized location. However, educators can't edit those because they are preset by the company. So, as somebody who was a student mid pandemic and was one of the first people to do solely online nursing school, I had that firsthand experience, and it was more than enough for me. I wasn't able to practice my hands on skills, and it was very overwhelming. So, I feel like it's not necessarily a one done substitute. So in the most recent years, we've seen artificial intelligence make its way into nursing education via virtual simulation reality nursing. So vSim nursing and artificial nursing is where students wear headsets and have controllers, and it's very similar to a video game where students are immersed into the clinical setting. And basically what it does is it shows how you are and how you would act in a clinical setting. Studies have shown that it can really mimic the environment that labs that cannot. It mimics the sights and the sounds that you might not be able to get in a simulation lab. It's also been shown to build student confidence in comparison to other learning environments. However, the downside to this is there's still extensive research being done on this, and it's quite expensive to accommodate it into your program. So I'm gonna elaborate a little bit on the use of virtual reality and simulation for nursing for a bit. I'm gonna show you a quick clip here by a company called Simex. Simex is a pioneer in the virtual reality medical world, and they've created close to lifelike simulations of healthcare that allow students to immerse themselves into the clinical setting without ever leaving the classroom, which is really beneficial. Virtual reality uses AI in a couple different ways. It allows for voice recognition, so you can speak with the patients or other NPCs, which are non playable characters, in the sim. Once it recognizes your voice, it prompts those NPCs to respond to you based on conversation. AI also creates an immersive experience, as I discussed, by constantly adapting to the tasks that you're completing within the simulation. And then finally, it allows for continuous content generation in response to how you play the game and how you complete the tasks that are given. So let's watch the video.
Healthcare is one of the most critical and complex industries in the world. It requires continuous training to keep up with the latest advancements in medical science and technology, and it demands precision and accuracy in life-threatening situations. That's where SimX VR comes in. SimX VR is the most comprehensive virtual reality medical simulation training platform in the world. Developed by physicians for physicians, it offers the world's most extensive library of VR simulated patient encounters for healthcare providers, doctors, nurses, EMS, and military personnel. SimX VR enables teams to collaborate and communicate effectively, improving coordination and reducing error rates across multiple specialties and learner populations. Our patented software enables students, instructors, and observers to work together in the same room or from across the world and repeatedly practice complex procedures, not until they get it right, but until they can't get it wrong. Scenarios are immersive and engaging and provide powerful reporting and feedback to track learner progress. By directly addressing the issue of physician error rates, SimX VR is helping to improve patient safety and outcomes across the world and across multiple specialties with their accessible, immersive, and affordable simulated patient encounters.
So as you can see, vSim is super, super helpful, and I'm hoping that in the future years we can see a lot more of it. So besides the clinical setting, there's a lot of other utilization methods of AI in nursing education. So first, we can use it to track student progress. So we can monitor students' academic performance in real time and analyze that information and identify strengths as well as weaknesses and areas that need improvement, so that way you as an educator know what to focus on. There's also widespread utilization of ChatGPT, as we discussed. Both students and educators can use it. For students specifically, it's really beneficial for completing homework assignments or creating presentations, and it can be used as an on-demand tutor because of its 24/7 availability. It can also be used by the educator in a couple different ways. The first is syllabus creation by asking ChatGPT to create like a syllabus based off of your content outline, or vice versa, create a content outline based on your syllabus. Educators can also utilize it in terms of lecture support by explaining complex topics to students. And then it can also present multiple versions of the same concept to reach different learning levels. Some nurse educators have also found it really useful for exam creation. So, an article published on the 29th of last month actually explored the use of AI when creating tests and found that it really did significantly reduce the workload of the educator, and it made it a more streamlined process for them. I've spoken to a couple nurse educators as well, who stated that when they first became nurse educators, they weren't taught how to create exams and they lacked a lot of guidance, so they utilized ChatGPT to make them. So as you can see, there's a lot of different uses for AI within the nursing education realm. So why is it important for us to discuss the inclusion of AI in nursing education? Do you guys think it's something that's worth having a conversation over? Well, I want you to take into consideration that healthcare is incorporating technology and AI in all aspects of the profession at rapid speeds. So if the profession that we're preparing our students for incorporate this concept, why shouldn't we? We're the ones prepping them to go into that field. If anything, we should want to stay on par with these current practices, and if that includes using AI and AI assistive technologies, we should be doing it. It's all about adapting to our ever changing needs of our society. We also have to take into consideration that AI may not always come with positive outcomes. However, teachers and students need to consider the ethical side of using these AI to complete assignments and making exams. But it also helps nursing students with their critical thinking skills if they're using it appropriately, because it teaches them to question whether or not ChatGPT is providing clear, unbiased, and error-free information. I want to touch briefly on the NCLEX and AI. Recently, we moved to the NCLEX NGN, which focuses more on case studies and real life scenarios than just the traditional multiple choice and select all apply NCLEX that we're all used to. Traditional NCLEX relies on what's called computerized adaptive testing, which changes the difficulty of the question based on student performance. The NCLEX NGN relies on clinical judgment model, where students show their clinical reasoning throughout the test. Both versions of the NCLEX are actually human written. There's no current data supporting that the AI or AI assistive technology is used in the creation of the NCLEX, but that doesn't mean that can't change in the future. However, with students, they can use AI and AI assistive technology to prepare for the NCLEX. AI can generate study plans or sample questions that mimic the NCLEX to allow students to prepare for it in any way they can. Benefit to this is that many AI platforms are free, so this method of studying is really accessible to those who might be of lower income. The deficit, though, is that sometimes the information might not be 100% correct and accurate, so it's really important for students to check their sources. So, on the flip side, there might be a few cons that we've been brought up before about using AI and AI assistive technology in the classroom. The first is privacy and security. So, some people have brought up the fact that AI can actually track student progress, which can be good, but it can also track their performance and behaviors, and it can be that, and that can be misused if that information gets to the wrong person. Um, Often, many AI technologies are also cloud-based, so those platforms are at an increased risk of hacking and other unauthorized access by third-party users. So it's just something to keep in mind is privacy and security of your information. So it also raises the question of securing patient information. So students might intentionally or unintentionally enter patient data into these platforms for homework or assignments, and that data can be stored, which causes breaches of HIPAA because that's protected health information. Another common concern is the intellectual property concerns. So, because AI technology like ChatGPT might store your information or searches or items you upload, it might be repurposed and pop up in somebody else's searches. So that can, raise concerns of who owns the intellectual property once it is entered into any AI database. The last point I really want to elaborate is on the concern of risk for over reliance on AI and AI assistive technology for not just the student, but also the educator as well. In the nursing classroom, we rely heavily on the process of active learning. So students are asking questions and they're actively participating in the learning environment. When we introduce AI into that, we shift from more of an active learning to a passive learning situation where students just take what ChatGPT says for face value and they memorize it rather than taking the time to dive into the material and question it and use it in their practice. So this in turn ends up weakening their clinical judgment and reasoning because students are no longer questioning material and they can ask just ChatGPT to come up with answers for them and solve problems. This can lead to issues down the line once they enter the nursing workforce because they need strong clinical reasoning skills. That's why it's really important to drive home the need for questioning anything that comes from online. So, as we continue to see an increase in AI in our future education world, we want to, look at what we might see. So, first is an increase in assisting student progress. So, I touched briefly on the use of AI in tutoring. So, there's an opportunity for AI to be even used even more in tutoring because of the aspect that it's more personalized experience outside of the classroom. So the student will have the opportunity to attend class, and once they get home from class, they can use their AI assisted tutoring to focus on concepts that they might need a little bit additional help with. AI can personalize that experience because it can skip topics that students have already mastered, and then it can also scaffold learning by applying different concepts from multiple different classes that the student might be in. Overall, it's available anytime that you need too, so it eliminates the worry for attending office hours or campus tutoring hours, especially if the student has a packed schedule and they're not able to get into it. Overall, the functionality of AI in assisting students is a positive effect. Next, we'll also see there's a great decrease in faculty workload if you use AI. This allows the nurse educators to spend more time on student interactions and personalized learning. By relying on AI to do stuff like read your papers or grade your exams or other assignments, it frees up your time and it allows to increase your productivity in other areas. So like I said, you can also use it for classroom management. So you can have it create your exams for you or mock scenarios. All of this is just about increasing the educator's time. So sometimes you might also, some educators are required to do advising. So if you're having AI complete those other tasks for you, you're going to have more time to advise your students. Finally, we have our data-driven insights. So this can be used by the educator themselves or the nursing program. As we discussed prior, AI collects student data regarding performance on like exams and stuff. This performance can be broken down into trends, so the educators can identify weaknesses that really need to be addressed. AI can provide early alerts to educators of students who might be struggling and need additional resources prior to becoming a severe issue and maybe not passing the nursing program. With the identified issues, AI can also assist in remediation plans to help turn that issue around. Nursing programs can also use these data driven insights to determine likelihood of students passing the NCLEX, and it can be also providing information to accreditation boards about passing rates and student learning outcomes. So to wrap up, I really want to drive home the point that AI is not something that's going to be a phase or something that's going to come and go. AI is something that we're going to continue to use in our daily lives, in our professional lives, and more importantly, our education. AI is something that's been around for a while and it's going to continue to be around for a while. So we need to learn to embrace it and use it in effective and appropriate ways. Our healthcare fields become more AI advanced, we need to stay on top of that on that same level as nurse educators because our job is to teach students and prepare them for the clinical field to the best of our abilities. So if this means we're going to need to teach with AI and AI assistive technology, we need to find ways to incorporate that into our classrooms. We need to teach our students to be flexible and always learning, but in order to do that, we need to reflect that practice ourselves. I do feel as a current educator and a future nurse educator in the classroom, we'll never be able to replace the true empathy and connection that we have as nurse educators. AI can't replace that. But I do feel that we can blend it into our classrooms to provide the best outcomes for our students. At the end of the day, AI is meant to enhance our teaching, not replace it. So I'd like to pose two questions for you folks to think about. First is, how do you envision AI supporting nursing students or nurse educators as we continue to increase adoption of AI into classrooms? The second question is, do you feel as though AI can cause more harm than good when using it in educational settings? So I'd like to offer my answers to those questions real quick. The first one, I envision AI supporting our nursing students in various ways, such as being an additional resource on top of class lecture time. There's only so much content that could be discussed during class, so using AI to supplement that is going to be super helpful. And then my second answer is I overall have a good feeling about the incorporation of AI into our classrooms because as we progress, I feel it'll better prepare our students and give them more comprehensive learning experience than just a lecture and clinical. That is, however, dependent on students using AI and AI technology in an appropriate manner and always checking their facts. Thank you guys for listening to my presentation. I'd really like to hear your thoughts about it. Please leave any feedback, comments, or answers to your questions in the discussion board. And thank you again. And here's all the resources I utilized for this